Good morning students. Today we are going to discuss about community health nursing 2. Topic is national health problem and you can find this topic in your syllabus unit 5. National health problem in India. So as we know that India's is a faster growing in the world for economic and the population. So though the economic is faster growing, but what happens in India, over one third of economic is spent towards food related consumption. So because of food they are using the one third of income. So what happens, because of that social security support for health, education, housing becoming critical. They are not able to spend much for social security support for health, education, housing, etc. Apart from that, again India is facing lot of health issues, health problems. Okay, in that mainly the when you find in Indian houses maximum number of unnourished people globally, and India also is a diabetic capital of the world. And then in India, the most maternal death happens because of the anemia, and the main cause of maternal death in India is anemia, and 20% of maternal death happens in India. Then, major health problems in India, most common and major health problems of India, those are communicable disease, non-communicable disease, environmental sanitation problem, medical care problem, population problem, and nutritional problem. So communicable disease means the disease what spread one person to another person, and that causes the number of people to get sick. And there are causes like germs like bacterial, virus, fungi, parasite, or toxin. Because of this what happens, the maximum number or large number of people get sick because of communicable disease. Then comes non-communicable disease. Non-communicable disease is that which not transfer or not spread from one person to another person. Then what all the non-communicable diseases? In non-communicable diseases, there are account of 53% of all deaths. So in when you see the worldwide or the statistical, it says 53% of deaths happens because of non-communicable disease. And in India, 44 percentage of death happens in India because the cause is non-communicable disease. So there are major causes, main diseases, that non-communicable diseases, those are diabetes mellitus and cancer, cardiovascular diseases, blindness. Okay, these are the four categories of major categories of non-communicable disease. Those are cardiovascular disease, diabetes, chronic respiratory disease, and cancer. So when you see the statistical like estimated annual death in India due to non-communicable disease, so in India they have estimated the like annually in a year how many death happens because of the non-communicable disease. So in that you find 2% of death happens annually because of diabetes, 13% of death because of respiratory disease, and 7% because of cancer, and then 28% communicable maternal or prenatal or nutritional problem, and 12% because of injury. And then other non-communicable diseases are 12%, and then 26% of death happens because of cardiovascular diseases. Then comes diabetes mellitus. So diabetes mellitus, already you have studied in your second year. So in this, the India, as I was saying the introduction, the India, like when you see the diabetes cases in India is highest when you compare to the worldwide, and over 77 million people in India have pre-diabetes, and an estimated of 40 million have diabetics. So 40 million people are suffering with diabetics in India. Then comes blindness. Blindness also a non-communicable disease, or this is a problem, that health problem that India face. So over in worldwide, when you see globally, there are 37 million blind people. In that, 15 millions are from India. And what is the most common cause for this blindness is cataract. That is the preventable one. Okay, because of cataract only the Indian people get blindness. Okay, so in that, around 35,000 corneas are collected annually national wise. So national wise they are donating the corneals, that is 35,000. But annually demand means how many people wants to do the surgery, means there are around 1,50,000 corneas are required, but collecting how much? Only 35,000, what is not at all useful for many of them. Then next comes cancer. Cancer also a major problem, the non-communicable problem that India faced, and over 1 million new cases every day. In India, you see 1 million is equal to 1 million, like 10 lakhs people. Every year you will find 10 lakhs cases in cancer. Apart from that, in 2012 globally, when the 8 million people died because of the cancer, in that nearly 7 lakhs were from India. And again, this cancer is the second most common disease in India, responsible for maximum mortality, that is death rate. Okay. Then comes cardiovascular disease. So everyone knows this cardiovascular disease. Because of this, so many deaths happens. Okay, because the heart failure in India due to coronary artery disease, hypertension, obesity, diabetes, and rheumatic heart diseases. Okay, these are the main cardiovascular diseases that can affect the people, and India every year they are suffering because of the cardiovascular disease, and 2.4 million Indians die due to heart disease every year. Then next problem is, we discuss about the non-communicable disease. Next one is environmental sanitation problem. So when it comes the environmental sanitation problem, so India, it's like sanitation wise, when you see, it's very poor. Okay, so what happens in India, the 400 million people defecate in open, means the latrines, the sanitary system is not good. So when you find the 400 million people defecate in open areas, open fields. Okay, and in that 44% mothers dispose their children feces in open. So when mainly in when you go to rural areas, so what happens, they'll not have the proper sanitation facilities. Okay, for that they'll do the defecation in open fields, and then about mothers, they dispose their children's feces, okay, waste materials in the open. That is around 44% of mothers does that. And again, India accounts about 60% of global and 50 of its own population open defecation. So open defecation, like in globally 60% of Indians do the open defecation, and in India when you see, it is 50% of population they go for the open defecation. And then About 48% in children in India suffer from some degree of malnutrition. Then what happens, 67% Indian household do not treat drinking water through its may be chemically and bacterially contaminated. So when you see 67% of Indian, they are not getting safe water as well. Whatever they are drinking, the taking the drinking water, it may be contaminated through the chemical and bacterial. Then comes medical care problem. So this is the third one, that is medical care problem. This is also a health problem in India. So when you see, India has a health policy but not health services. So what happened, based on that, health services have primarily created to the urban population. So because when you see the health services, you can find in urban population. So whenever, if anything, any critical care, everything, when you come to urban only, you can find the treatment, but in rural area it is very rare. And the population ratio for doctor population ratio, so like in India it stands like 1:1700, okay, less than the WHO prescribed. So as for WHO, the one doctor can see 1000 population, but when you come to India, here it is 1:1700. And there are almost 4 times the medical practitioner in urban than in rural area, like 10,000 population. So what happens, when you go to rural area, there you will not find the doctors how much they require, but when you come to urban places, you will find 4 times medical practitioners, means more medical practitioner will be available in urban area. Then next comes population problem. So everyone knows the India is a faster growing population. So because of population is the even population wise, worldwide you see, the India comes in second highest population in the world. So in that what happens, the 17% global population from India and 2.5% of the earth's land area. Okay, so in that, because of overpopulation, you must be knowing the what all the problems happens because of the overpopulation. It affects everywhere, like ill effects, what all the effect because of the overpopulation, like rising unemployment because of the overpopulation. Okay, and not only unemployment, like people are staying in home, they are not getting good job, because as I was saying that education services are not good. And then poverty because of unemployment, poverty, then inappropriate utilization of available manpower, like whatever the manpowers are there, that is not been utilizing properly. Then inadequate infrastructures, resources, scarcity, because scarcity means like because crimes can happen because of unemployment and the food is not given properly. Okay, and scarcity, drop in production, the production will be not more, and rising cost. Everywhere you see the cost of everything, like especially when it comes to food, the cost is going higher and higher. These are the problems happens because of the population growth. And then this is the health of the state, like how the changes happen in health of the state. In that you can find, like in when this is not visible properly, but it is like in 1990 how it was, and in 2016 what all the changes happened. So when you see here in 1990 the 53.6 percentage in a green color, it's all about communicable disease, maternal, neonatal and nutritional problem was there in 1990, 53.6 percentage. And you can find the 37.9 percentage it is about a non-communicable disease. And then 8.5% is it is the injuries, because of injury how much it happens. Okay, so when you come to see the 2016 what all the changes happen, so you can find this 61.8 percentage. This is the percentage because of non-communicable disease what I was discussing. Okay, in that you can find rising of non-communicable diseases, and about communicable disease, neonatal, maternal and nutritional is 27.5 percentage, and you see 10.7 percentage because of injuries. And then comes nutritional problem in India. What all the nutritional problem the India is having? So malnutrition, as I was saying in introduction, the India is having more undernourished people, and that is like under malnutrition makes the children to get infection. If the children have malnutrition, they are very susceptible to get infection, and that result the child mortality. So what all the major nutritional problems suffering by the Indians, that is vitamin D deficiency, calcium deficiency, vitamin B complex deficiency, zinc deficiency, low birth weight, protein energy malnutrition, xerophthalmia, nutritional anemia, iodine deficiency disorder and fluorosis. So we'll discuss one by one. First one is vitamin D deficiency. So vitamin D deficiency is the most underdiagnosed and undertreated deficiency in the world. So they will not find the they will not do the diagnosed, and it is not treated, undertreated deficiency in the world. And then nearly 60 to 80% Indian population is deficient in vitamin D. So according to the WHO, the daily vitamin D requirement of like 600 unit and can be obtained by a daily 15 minutes walk in the sunlight, and yet it is persist. So vitamin D is not like we have to take from the food, though we know we can get the vitamin D under the sunlight, like morning sunlight. If you are walking for 15 minutes and you will get the vitamin D, so that is also not happening. Because of that also vitamin D deficiency is still it is that. Then comes vitamin B complex deficiency. So when it comes to vitamin B complex deficiency, nearly 80% of Indians have vitamin B12 deficiency. Then comes calcium deficiency. So calcium deficiency mainly what happens if the calcium deficiency is there, that leads to osteoporosis among the elderly people. If elderly people they are not getting proper calcium, they will suffer with osteoporosis, that is bone diseases and deformities. Then because of low calcium intake in India, you can find girls under the age of 14 to 17 they suffer with a calcium deficiency. Then comes zinc deficiency, that is high among lactating women in India. So because of that, you know very well that when the pregnancy women in 3 months, they'll tell them to take calcium tablet, zinc tablets. Okay, so in India mainly 50% non-pregnant and lactating women in India have zinc deficiency. Then comes low birth weight. So it is very common in India, so you can find low birth weight babies in 19% in urban area and 23% in rural area. So average 28% of children born in India are low birth weight babies. Then comes protein energy malnutrition. So this is the prevalence of stunting among under 5 children in 48 percentage. So you can find the under 5 children will have protein energy malnutrition, and then apart from that underweight like 42.5 percentage children's. So these numbers are higher in magnitude, and in rural area the children go through the malnutrition in more among urban population. So when you compare to the rural area and urban area, the rural children have more malnutrition problem compared to urban population. Then comes xerophthalmia, that is the eye disorder. In that what happens, the children's around age group of 1 to 3 years, or you can see the age group of 1 to 5 years of children, they suffer through the xerophthalmia. Xerophthalmia is a disorder or the condition in which the dryness of conjunctiva and cornea of the eyes. Why xerophthalmia happens? Because of the vitamin A deficiency. Then comes iodine deficiency disorder. So iodine deficiency disorder also more in India. So when you see in Maharashtra it is 11.5 percentage, and West Bengal 9 percentage of people have the iodine deficiency disorders. And not only that, again the about 54 million people are estimated to have goiter. Goiter is a it is a condition where the abnormal enlargement of thyroid. Okay, so 54% million people are suffering with goiter, because goiter happens because of iodine deficiency. And then apart from that, you can find 6.6 million like mild psychomotor handicaps. Like you can find because of iodine deficiency there are chances of psychomotor handicapped also. Then comes nutritional anemia. So nutritional anemia, as I was saying before only, that our country is compared to developing countries in India is higher than the other developing country, affecting nearly 50% of the population. So 50% of the populations are affecting by nutritional anemia. So mainly including 39% is having in mild. So in India compared to men and women are very much affected with the anemia. In that 39% is having mild anemia, and 15% is women are having the moderate, and 2% severe anemia. So in India, every woman, in 2 women, 1 will be suffering with the anemia. And then comes the, according to the WHO, the prevalence of the anemia in India is about 65 to 75 percentage. People are suffering, the women are suffering with. Then comes fluorosis. Fluorosis, it is fluorine is the natural thing. In that what happens, nature, that is about 96% of fluoride in the human body is found in bone and teeth. So with this fluorine, this deposit in our body, that is bone and teeth. So fluorine is often called as two-edged sword. Means two-edged sword means the good thing also, and if you take more it can affect, and if it is not taking in a low amount of fluoride, then that also can affect our body. So that is why it's called a two-edged sword. So what happens, the prolonged ingestion of fluoride through drinking water in excess of the daily requirement is associated with dental and skeletal fluorosis. So if you are telling prolonged or more amount of ingestion or taking the fluoride, what happen, that can affect our dental and skeletal fluorosis, that can leads to dental and skeletal fluorosis. And inadequate, if you are not taking properly, the inadequate amount of fluoride in drinking water is also associated with dental caries. If intake is less, then it can have dental caries. Then comes conclusion together. So everything we read, the main things that is about the health problem in India, in that communicable, non-communicable, population problem, medical care problem, nutritional problem, and environmental sanitation. So in that the communicable disease, that I have given the assignment that you have to write, because you have already read that in your first year and second year. And that's all about the health problem in India. Thank you.